So part 3 of the evening is when we open up the event to the floor for questions and answers. I have a magnificent team to field the questions that will be coming from you. And let me suggest also some terms of engagement. In a moment I'll just briefly introduce the members of the board, but I would ask anybody who has a question, please, to observe the normal courtesies of introducing yourself and saying who you are and where you're from. Then what I'd like to do is perhaps marshal 2 or 3 questions at a time and then allocate them to the best qualified member of the board to answer them. But please may I just introduce my colleagues. On the far right, Joanne Wass, who's our personnel director. Tim Kelsey, I think you've already seen in action. Dame Barbara Haken, who's our deputy chief executive. Those 3 are executive directors, so I'll continue with executive. The difference between executive directors and non-executive directors is that the executive directors do all the work, and they're full-time, salaried members of the board, and the non-executives come in from time to time and bully the executive directors. But that's a very brief description. So I'll continue with the executive team. Jane Cummings, the Chief Nursing Officer, who you've heard from, Sir Bruce Keogh, who you've heard from, our Medical Director, Ros Raughton, Director of Commissioning, Bill McCarthy, you've just heard from, our Policy Director. Coming along here, well, you've heard the outstanding Finance Director and the Chief Executive, of whom I shall say no more. Now, let me come back to the non-executive directors, Karen Devane, who's also Chief Executive of Macmillan Cancer Care, so brings a great wealth of experience from the voluntary sector. Ed Smith, who has a wide portfolio, but is actually a former senior partner of PwC, but chairs World Wildlife Fund UK and Birmingham University. Moira Gibb, a great length of experience with social care and with local government, and a former Chief Executive of the London Borough of Camden. Margaret Casely Hayford is the Company Secretary and Director of Legal Services for the John Lewis Partnership, another great social institution in this country with a real understanding of values and of consumers. And Naguib Kiraj, who works closely with the Aga Khan Foundation. So that's the team. Let me now invite any questions from the floor. We have roving microphones, and we'll kick off as soon as we have the first question. Please, it's over to you. There's a gentleman in the back. Oh, no, there's a gentleman here, and then I'll take the gentleman in the back with the pink tie.
Thank you. My name is John Wargrove. I'm now retired, but I did work for the NHS for many years. I'm very impressed with Dave Nicholson's suggestion for transparency and openness, and I think this should extend to all areas of the NHS. I wonder whether, with that in mind, whether the senior members of the NHS who are marshalled before us now would be prepared to declare whether they have all their own treatment from the NHS or whether they sometimes seek private care. And if they did seek private care, it would be illuminating to know their reasons for doing that.
OK, then may we take then the question from the gentleman with the pink tie. Apologies for that description, but you're a long way away, sir.
Hello, I'm Simon Chapman from the National Council for Palliative Care and the Dying Matters Coalition. First, just thank you very much to NHS England for organising today. I think for a first AGM, having been here all day, it's been interesting and illuminating, and thank you and well done. And thank you for putting end-of-life care on your agenda. It's been really interesting to hear all the feedback from those workshops. There's been a lot of feedback today, and actually NHS England has had a lot of feedback in many consultations over the last year or so, as have other statutory bodies. Will you tell us how you've acted on that feedback today, this time next year? Will there be a session on the lines of "you said, we did"?
OK, one further question. Yes, gentleman over here.
Hello, my name is Amit. I really wear multiple hats, so I've had opportunity to be of service to NHS back in the days of the national program, trying to understand the traceability between the commissioning and the suppliers who were delivering the program, and improving that traceability framework. But more recently, I have made myself useful as a layperson on the cure review, and I also ended up being the only chair for the CCG authorization process, only lay chair, for the CCG authorization process. And I'm also an elected public governor, one of the very few elected officers who are not politicians or party political in any way. Tim came to the Foundation Trust Governors Association's meeting last year when you were commissioning board Special Health Authority. And I asked him, it's all very well for people who are sick and who need care, and of course, NHS is there to serve them. But at the end of the day, it is health service. Its primary goal, I think, is to keep people healthy, happy, live long and prosperous lives. So what are you doing about that? And at that time, his answer was somewhat along the lines that, it's to do with Public Health England, nothing to do with us. Of course, since then you have changed your name. You are now NHS England. You are Health Service for England. Has the situation changed? How are you working together with Public Health England? What about people who want to stay healthy?
So do you want to put that question again to Mr. Kelsey? Shall we start with Tim? I'll take the questions in reverse order, if I may.
Is that on? Oh, yeah.
Yes, that's
Well, I'm surprised if I said that belongs to Public Health England, because one of the biggest parts of my responsibility is precisely to provide information to patients and the public so that they can absolutely take control of their own health when they wish to. And we, as you'll see already, we have been, we referred to it earlier, publishing vast amounts of information alongside all sorts of online and other services so that people can, when they wish, make the most of taking control of their own health and well-being for themselves. Public Health England, however, has a very important role, clearly a fundamentally important role to play as well. But just to be clear that in the promotion of this vision of putting the patient absolutely at the heart of healthcare, a really important part of that is to empower people with the tools and services they need, the information, amongst other things, they need to take precisely that control over their health and well-being. So my answer is it's a top priority for us. Hold us to account for delivering it over the next year, but we are really working on it.
Okay, then can I take the question from Simon Chapman, which was, you said we did. What are we going to say to you next year as we sit here in relation to what we've heard from you tonight? And Bill, I wonder, I'm sorry about, as it were, allocating these questions in this way, but Bill, I wonder if you might venture a response to that one.
Yeah, a couple of points. So you said we did. It's been live streamed. So the thought that we could kind of brush this aside and forget about it, even if we were so inclined, is impossible. So in a sense, you have the documentary evidence to check how we act upon this exercise today. But my second point is actually our ambitions higher than that. So this isn't a kind of a one-off, a really important event where we listen to a set of workshops and then off we go to do our work till next year. This genuinely is the start of a much more open, continually engaging, involving process. So as Olivia was saying, there are other events happening today around the country. We're expecting all of our health and wellbeing partners to be working with us in every community around the country to understand and hear and listen to the priorities, the concerns and the aspirations of local people and act upon them. And all of that then will get captured in the planning round, the visions that will be put out locally. So anchoring into the transparency that David and Tim have talked about, it will be there for you to see and to check up on it. So this isn't us, coming out for a day in the sun and then popping back into a shed somewhere. This is the start of an open and engaged process where you will be able to hold us to account, both for the good things we achieve and, to be honest, for the things we'd hoped to do and weren't able to.
Thank you very much for that, Bill. The first question that we were asked from John Walgrove related to treatment from the NHS. As far as I know, all of my colleagues do turn to the NHS for their treatment. I chose a particular route, which I don't think is available to everybody, which is that I married my GP. And this brought all the necessary services in-house. And I've never been allowed a day off work since, nor have our children. But I simply take that as read so far as the board's concerned. Now, please, may I take another clutch of questions? Right, the hand's going up. Please, may we start here in the front row? Down here, please, John. Identify somebody in the front row, but there's wide enthusiasm across the hall. And then there's a gentleman there to come in next. Please, madam.
Hi, my name's Inga Wallace, a stroke survivor with aphasia, so bear with, and patient involved in lots of NHS. It's an observation rather than a question, is I have noticed all day and tonight seeing the board, where are the young people? Because it's a new world. They have been brought up in the new world. They expect different in the world than we have been brought up to expect. And being a mother of people in their 20s and having been a teacher in a pupil referral unit of young people who are challenging but amazing, there is a resource out there of fabulous ideas makers aged between 12 to 30 that I really hope this board will engage with, focus groups, and really, to be honest, I would like to see someone on that stage aged under 30 this time next year. No, because one of the ways forward for 7-day services and the like is about collaboration and communication. And younger people are genius at brainstorming ideas and ways of working. It comes natural to them, and they are an asset that I'm not quite seeing yet. So that's just an observation for you, and I hope, as a person with a daughter of epilepsy who has been in and out of NHS services, she's got opinions, but she's got nowhere to take them, and nobody's attracting her in a way that attracts her. So please think about young people.
Okay, thank you very much for that. And I should just say also, so my apologies for the ageing population on the platform, but had you been here earlier when we had the Whiz Kids here, they were absolutely fabulous. I mean, I was really moved by what we heard from them. So please, we're not overlooking that group at all. Yes, Tim Kelsey.
Olivia. Yeah. So the team that has organised this event is just about to launch a major initiative for young people, absolutely recognising the vision and energy that we need to glean from all kinds of patients and citizens and so on. Plus also, of course, just another point, Jane has done some fantastic work getting together people as volunteers to be caremakers, rather like the Olympic model. So we are really aware of the absolute importance of kind of working with everybody, but especially with young people as well. So.
Okay, thanks very much. I'm conscious that time's against us. I want to take a few more questions, and we'll cluster them together, and we'll answer everything that we can, but I'm sorry if I don't get right across the room. There's a gentleman up there, number 3 beside him, and you with number 4. Please.
Good evening. My name's Thomas Harrington. Could you tell me how you see mental health services developing over the next 10 years?
Good, thank you very much. We'll Thomas Harrison. Next one, please. Madam.
Thank you. I represent the Community Voice, which is an umbrella organisation in North West London and South West Hertfordshire, totally independent but totally dedicated to good NHS services. I'm surprised that we've heard so little about NHS England's role at a local level. In the past, we have had meetings held in public where we could know what was happening locally, but there are no equivalent to board meetings in public at a regional level. But in fact, you provide specialised services which are of huge importance to local people. So my plea is, when will you hold local public meetings where, if possible, your officials can not only give information, can also hear the views of local people?
Okay, thank you. Could you just give us your name?
My name is Joan Davis.
Joan Davis,
and I have written to you 3 times and await a response.
Okay, thank you very much. Let's take another question. We better come over to this side of the hall. If we make the gentleman, all right. John, choose your questioner, please, and we'll take a question.
Stephen Bubb, I run Kivo, the Charity Leaders Network, and my question is for Kieran. I've loved the many references tonight to the role of the third sector, the voluntary sector. I just wonder, how big or small do you think the rhetoric-reality gap is?
Oh, good. Right, okay. That one's for Kieran. That's got his name already on it. Let's take another one, and I'm conscious that time is running out, and we'll group all of these together. Yes? Where there's a microphone.
Hello, good evening. My name's Gilbert Wheeler, and I'm a patient, and I work for a charity on a voluntary basis. Is the board aware that today the CQC held a similar event as you've held here? There were so many good aspects of today that came out, and they are looking at various subjects that we've raised today, possibly the involvement of a patients panel, reviewing hospitals, and other areas. There are lots of things coming out of this meeting today that will probably come to light in time. But I just wondered if the board was aware this meeting took place today as well. Thank you.
Okay, thank you very much. May I now field some of these questions to my colleagues? The first one was Inga Wells, which was the question about young people. I think we've had a response from that from Tim. So, if I may, I think we'll move on to that. Thomas Harrison asked about mental health services in 10 years. What would it look like? And I wonder, Bruce, whether you might help us to respond to that.
Thank you. The first thing to say is we're developing a mental health strategy, and we'll be asking people to help us with that. But the starting point is that the importance of mental health has historically been, I think, undervalued both in society and in the NHS. And a turning point, I think, for me, during the course of my career was a recognition that mental health was also strongly associated with early mortality and other noticeable physical conditions. So, for example, today we heard that people with schizophrenia are 90 times more likely to get colorectal cancer. We know that it's associated with an increased incidence of cardiovascular disease because people smoke more, etc. So the impact of mental health is increasingly being recognized on what might be otherwise deemed as unrelated physical conditions. So that will help to drive, I think, the thought processes of clinicians in the NHS. But importantly, I think we're going to see more self-care, and we're going to see much more integrated care in the community. I do worry sometimes about the fracture between community care and mental health and hospital care, accountability and the way those services are integrated. And one of the things that also niggles at me that I don't think we haven't really got to grips with is that mental health problems in one individual become a problem for the whole family. So it can be a familial disease in that sense. So I think we've got a lot of work to do in terms of mental health, and probably our biggest challenge is actually changing public and internal NHS perceptions about its importance.
Thank you very much. Joan Davis's question was about local services and open meetings at a local level. We haven't really talked much today about CCGs, but since David mentioned them, may I call upon him to respond?
This whole issue about the way in which we interact with the public is one which I think we are kind of building and learning as we go along. Of course, at a local level, clinical commissioning groups are the kind of main base on which we would expect those conversations to go on. And as many of you know, if not all clinical commissioning groups have mechanisms to speak to their local people. I think increasingly we will see engagement and discussion at a health and wellbeing board level. And if you think about the future, and NHS England is part of every health and wellbeing board, many of the big decisions that are going to be taken in the future, if you think about the way in which the resources are going to be transferred from the NHS to social care, and the integration fund is going to be built up, those discussions will take place at health and wellbeing board level. And I think there is an issue about how health and wellbeing boards engage with their public. The third issue then is NHS England's specific commissioning arrangements. And I have to say that we haven't quite got to the end of our debate. And I'm really sorry that you've written to the Chairman 3 times, not got a reply. I can't imagine why that is, and we will get onto this straight away. But it's something that's been raised by our own staff, in the sense of they realise that they're engaged at a regional or a local area level at making really quite significant decisions, and they have identified a gap in the way in which they operate, and we're very keen to think about how we could fill that gap in a constructive and helpful way. And certainly I think this is one of those things that you say and we do sort of thing. I think we should take that away and think really carefully about how we can get that engagement at that level, because it's in both of our interests for that to happen, and if we're really true to transparency, that's exactly what we should do.
Thank you very much. We now turn to the Kieran Devane question, which was asked by Stephen Budd, and that's, what's the difference between the rhetoric and the reality? Kieran, we're all waiting.
Thanks. I'm sure Bruce will have an opinion as well. If we go back to the white paper days before the future forum, I would have said I was quite worried, because I think the white paper really projected engagement with patients and the public as a very consumer thing, which is good, but it's not sufficient. And I didn't feel at the time that there was enough of an emphasis of listening to patients, patient organisations at a policy level and a service design level. If I take the mental photograph now, I think we've moved on hugely. So I think my short answer is the gap is whatever we allow it to be, as if I can be voluntary sector for a moment. And I think we've come a long way, because I think we have to demonstrate our value in terms of insight, in terms of data, in terms of research, the end-of-life question in terms of the services that hospices or the Marie Curies of the world can provide. But I think we have to be very assertive in doing that, confident, and make sure that not only at NHS England nationally level, but also by CCG, by Health and Wellbeing Board, that we get it right. And I think I point to some very good examples. I think the fact that the board of NHS England does have two chief execs of voluntary organisations on it clearly shows that NHS England wants to listen. Neil Churchill, who is the chief exec of Asthma UK, is now one of the domain leads looking after patient experience. So I think the relationship and the thinking and the openness is much, much better than I feared. But I think, again, being voluntary sector for a moment, I think it's up to us. I think we have to demonstrate our value intellectually in terms of the knowledge we bring, and also in the quality of the services that we provide. But it has come an awful long way.
Bruce.
Thank you. There is no rhetoric in my mind, Stephen, and I should declare an interest. I'm on the council of the British Heart Foundation. They've paid for a considerable amount of research I've done over the years. They've paid for a year of my salary as a research fellow and for several years of my salary as a consultant. And one of the things that I've learned from that close association with a major charity is that, first of all, they understand what patients want. Secondly, they're trusted by patients. Thirdly, they aren't subject to any kind of external influences which might make them take one view or another. And finally, they conduct and fund some of the finest research in the world. So I think that they have been a grossly underutilized resource in the NHS for a considerable period of time. And during the course of my time as NHS medical director, I had meetings with chief executives of some of the big charities, asking them to help us with policy. And indeed, David Nicholson and I had a meeting with the chief executive of one of the very big charities the other day, and asked a group called the Richmond Group, which consists of the chief executives of many of the big charities, to help us not only with policy development, but with how we can improve the delivery of services to patients.
Right, well, thank you very much, Bruce. The last question, which was from Gilbert Wheeler, asked whether we were aware of a CQC event today. I can assure you that none of this board were at the CQC event, because I had them all locked in a room while we went through an extensive board meeting today. But of course, we work very closely with CQC. This is the Care Quality Commission, as we do with all the other partners, our arm's length partners. One of the great difficulties is that there is a fragmentation of responsibility for different aspects of total care across the whole of the NHS, with CQC, with Monitor, with NICE, and also, of course, reaching out into local government and our partnership with them. We are committed to making that partnership work. It's quite difficult at times when you have autonomous arm's-length bodies all trying to achieve things within their own terms of reference. However, it's our responsibility to draw the whole of this operation together and make sure there's clarity. Clarity about our objectives is only going to be achieved if we've developed those objectives in consultation with the public and patients, and that's what this evening, and indeed the whole of today, has been about. I'm going to draw the proceedings to a close now, but before I do, I've got to issue some warm thanks. I think, first of all, to Olivia Butterworth and to all the participants in those workshops this afternoon. People gave up their time voluntarily. They didn't have to come here. They gave up their time because they want to make the NHS better and better all the time. We owe you an enormous debt, and we're enormously grateful to you for all that you've done and for those wonderful presentations earlier. So thank you all very much. Secondly, of course, I must thank my board, or I'll be in difficulties with them, but for answering your questions so openly and honestly tonight. But thirdly, and the real thanks go to you. You've come, you've given of your time, you're, I think, anxious to watch us develop, and we will develop. I hope to see everybody here next year, and we will do the You Said, We Did, because we are a growing organisation. Please take this evening as a pledge to the openness that we regard as being at the heart of everything that we do. I'm frustrated, I know, that we didn't have longer. You're frustrated that we were not able to take all the questions. We are willing to linger now informally and to talk to those of you informally who would like to do that. But may I, in the interest of drawing the proceedings to a close, now say the AGM, the first ever AGM of NHS England is now closed. Thank you so much for attending this evening.